Hi, this is Priyal Doshi, physical therapist and wellness consultant. And here is our guest, Akshay Nadkarni. Dr. Akshay, please tell us a little bit about you.
Yeah, I'm a cancer surgeon and a laparoscopic surgeon at Vapi, Killapardi and Valsad. It's a small town in South Gujarat.
So he's our guest from India. Okay, Akshay, let us know a little bit about your. I know you actually teach other surgeons worldwide. So tell us a little bit about your technique and how you empower other surgeons to be good at what they do.
So, what is changing in the last 10 to 15 years is the quality of education in the world. So, the technology is rising. There is robotics, there's laparoscopic surgeries. There are lots of doctors coming out from good colleges. But over the last 5 to 7 years, we have seen that the mediocrity amongst doctors is increasing, and that's where we, as an academy at Nadkarni Medical Training Academy, we have this principle of training the qualified doctors for the exact skills in gynec endoscopy and laparoscopy. So we realized that it is a skill development program where people and doctors all over the world do not get hands-on training program, which means that they are coming out of colleges and they are not getting sufficient patients to operate upon. And laparoscopy is one thing which is needs hands-on practice, and that's where we in India give you hands-on training program to any gynecologist or surgeon who's interested in learning laparoscopy.
Okay, great. Now, what are the most common cancers in India versus Western world?
So, as you see that with the changing trends and lifestyle, the incidence of cancer is on a rise, and we in India versus the Western world, there's a hell lot of a difference in the epidemiology and the characters as well as the treatment protocols. In India, it is more of the oral cancers or the lung cancers, which are more common because still tobacco is the most common cause of cancers. In the females, in the poor population, which is the maximum, is the cervical cancers, and in the semi-urban and the rich class, it is the breast cancers. Whereas in the worldwide, it is prostatic cancers in the Western world in the men and breast cancers in the women.
All right. Okay, so let's talk a little bit about cultural influences on cancer. How do cultural attitudes impact cancer care in India versus the world?
So it's a lifestyle in the sense in India you still see the poor patients, you see people in the villages. There is illiteracy, there's lack of knowledge. We are still fighting with tuberculosis and other basic diseases which is eradicated from the Western world. In Western world, it is obesity and the junk food that is the most, and the stress. So the stress versus lifestyle, this debate is always going to lead to. So the Western world goes towards obesity and junk food, and that leads to. And obesity is the biggest cause of cancer in the women for breast cancers. Whereas in our side, in India, it's still because of illiteracy, they do not come. They have breast lumps, but they do not come forward. The cultural influences in our Western world, you have regular checkups, you have body checkups, which is not a condition in India. So India still needs to put in screening protocols and help in prevention of cancer or at least early detection. So there is a lot of homework that the third world countries and the developing countries need to do.
All right. Yes, that is true. And so, how do NGOs and government bodies help raise awareness?
So in India, we have this Ayushman Bharat schemes of Narendra Modi, who's put in a very good system for the tertiary level because the government is not able to infiltrate into the interiors. They are giving basic services. They give mother and child health. They are giving medical services. But for super specialty, they tie up with private centers like ours, where Ayushman Bharat Yojana inculcates the private hospitals to give the treatment totally free of cost, and the government sponsors the program. They also do a lot of camps and awareness activities. We as a foundation, Nadkarni Medical Foundation, is a charitable ATG certified trust, which does cancer charitable awareness programs because people are very scared of cancer. In India, around 85% of cancers still come in stage 3 and 4 because of lack of awareness, and the overall impression about cancer is very bad in India. So that impression needs to change with a lot of NGOs coming forward and helping for cancer awareness and of course early detection.
Okay, great. So we are doing this podcast to spread awareness, and Dr. Akshay, he has the foundation to spread awareness and help people in rural areas. And I also try to spread awareness and support other organizations. They are involved in breast cancer awareness programs, innovations, and research. So we will talk more about this. But at this point, Akshay, thank you very much. And you will hear more on each topic in detail. Thank you.
Thank you, Priyal.
And we have our guest, Dr. Aditi Nadkarni. Hi, Aditi.
Hi, Priyal.
Tell us a little bit about you.
So I'm Dr. Aditi Nadkarni. I'm a gynecologist and an IVF specialist, and I work in a rural center in Kilapardi, that is India. And here I am with Priyal today.
All right. Thank you, Aditi, for your time. And we look forward to share your knowledge and spread awareness about global infertility. So my first question is, how has infertility awareness evolved?
Yes, because of too much of social media influence and too much of because the couples are coming and seeking help nowadays. Way back, few years back, it was not the same condition. Couples would feel shy and they would not come up and meet the doctors, the gynecologists. But now, yes, globally, the infertility has been on a rise, and also in India too. Of course, it's a taboo topic, but yes, people do come ahead and seek treatment from the IVF specialist.
Okay, very good. Here we are talking about global trends in infertility. So what factors influence infertility rates?
There are male factors, there are female factors. Female factors, the most important is the tubal factors, where the tubes are blocked. That is very common in our country because of tuberculosis, because of chlamydial infections. Then the second most important factors could be some uterine factors because of some Mullerian anomalies, that is congenital birth defects. In male, yes, because of low sperm counts, because of nil sperm count, and all these could lead to male and female factors. Sometimes there could be factors in both the couple. So that these are a few factors.
Okay, so are people opting more for treatments or natural alternatives?
Yes, in rural India, definitely they still seek natural treatments. They go for Ayurvedic, they go for homeopathic, and lately then they come to us and then they seek treatment. But yes, finally they come to us and usually they get pregnant. And naturopathy is also one of the things which many people still believe in India.
Okay, so how do social pressure affect individuals?
Yes, socially there is a lot of pressure on the couple in India. So once they get married and after a few years, they usually are under the societal pressures of planning a pregnancy. So that is definitely there. The relatives, there is peer pressure, and but yes, definitely there is social pressure. So that is one of the reasons why the couples definitely come to us and seek treatment.
Okay, so here a little bit we want to discuss about the causes of infertility. So what are common causes in men and women?
So the most common causes in men could be because of tobacco consumption, because of stress, because of lifestyle problems. Obesity could be one of the problems. In females, it's also again stress. It is lifestyle problems because of bad eating habits, because of no exercise, and of course obesity is also one of the problems. And nowadays PCOS is also on the rise because young people, they have poor eating habits. They are more into burgers, pizzas, and all the bad stuff, or you can say the junk stuff. So that is also causing a high rise of infertility.
Okay, so what are the common infertility treatments?
So the most common infertility treatments that we have are, we do ovulation induction, that is we stimulate the patient with injections, with tablets. We do a sonography, and of course there is IUI, that is intrauterine insemination, and then there is IVF, that is in vitro fertilization. So IUI is one part of infertility, where a simple, the sperms are just used, and they are used in a centrifuge, and the sperms are separated. The good sperms are injected inside the lady, whereas IVF is, we take the eggs out, we do an ovum pickup, and the one egg and one sperm, that is, we do a ICSI, that is cytoplasmic sperm injection. The sperm is injected inside the oocyte, and the baby is formed in the lab, and then this baby or the embryo is transferred inside the womb of the lady. So this is IVF and the IUI. So IUI and IVF are the two most common treatments in related to infertility.
All right. Now let's talk a little bit about prevention. So what preventative measures are being taken?
There are preventive measures like, good lifestyle modifications, doing regular exercises, having a healthy diet, and having a healthy schedule, and just to fight out stress, which is the most important cause of infertility. Many a times the couple just comes to you and we ask them to be just stress free, and the next month her pregnancy test comes positive. So we feel stress is a very important factor which is affecting the individual or the couple.
All right. Well, so we will talk a little bit more about the future of fertility, the personal insights and other stories, but I think we are going to take a pause here. Thank you very much, Aditi, for your time.
Priyal. Thank you so much.
Stay tuned.